So 31 years ago, New Zealand became the first country in the world with a state-sponsored nationwide needle exchange program. Today, hepatitis C is a key concern for our community, and that's why at the needle exchange program we're launching this campaign. Saying that you're an injecting drug user isn't normally the sort of thing that you openly admit to another health professional or anybody for that matter, because of the discrimination and stigma that we experience. Our community also doesn't access mainstream health services or access them in an open and honest way. Because of stigma and discrimination, it doesn't always feel safe to do so. That's why we at the Needle Exchange have been working with other health professionals to make sure that services are available where our community is at and where our community feels safe.
It is a blood-borne virus, and it's a lot more prevalent globally than HIV. Hep C is spread completely through blood-to-blood contact. So the blood of one person has to come into contact with another. It can be anywhere from about 4 weeks to 6 months before it will show, and that's called the window period.
People who inject drugs bear the burden of hepatitis C, and it really does affect our community very significantly. Internationally, New Zealand's not much different from the rest of the world. At least 60% of our community will have been exposed and have hepatitis C. And one of the reasons it really affects our community is because one of the main risk factors is injecting drug use. And hepatitis C is a really strong virus. It can live outside of the body. It's not like HIV, which is quite a weak virus. It can live in blood that might be stuck in a syringe, on a needle, in a tourniquet, on a spoon. And that's how, if we're sharing equipment, our community is contracting and has contracted hepatitis C. It doesn't matter if you're injecting opioids, methamphetamine, or steroids, or any other drug. You need to get yourself tested for hepatitis C.
It's a blood-to-blood virus, so you've always got to think blood-to-blood. So we have quite a few who have had tattoos from using razors, sharing razors, or toothbrushes if you've got gum disease. Some have been born to a mother with Hep C. There's different symptoms for different people. Some get all of them, most get none of them. The one biggie is fatigue. People find that they just hit the wall at about 3 o'clock in the afternoon. And by the time they're starting to get symptoms, it may be getting to the stage where they've got advanced liver disease.
So when we contract hepatitis C, there often aren't symptoms at the time. You don't know that you've got it. If you have shared equipment that's been infected, there's nothing that's going to tell you you've now got Hep C. Sometimes we might feel a bit tired, a bit run down, lacking in energy, fatigue, and those symptoms can often be confused with just feeling run down, hanging out, withdrawal. So it's really, really important that we get a test, because you don't know if you have Hep C unless you've been tested.
We don't do this alone. No one can do anything in isolation. So we work with other community health providers. So they come into the exchange, they provide the testing for us, some of the nurses. So we work alongside other people. So we're bringing the services to our people, rather than our people have to go and try and access them outside of the needle exchange, which is a huge barrier for our people. So at the needle exchange across the country, we're all bringing services to our people, which makes a huge, huge difference.
Obviously, their main priority is to be getting equipment for injecting purposes, but also they go there for advice, and then they will so often refer them in here if there's any questions about Hep C. Our main aim really is to provide a non-judgmental attitude that people could come. So for the first time we obviously take some details about who they are and we keep it fairly simple. We explain Hep C to them if they don't know it, if they don't know anything about it. And we tell them basically exactly the process that has gone through to get to treatment. We're really lucky now that we can treat here rather than having to send through to the hospital. But yeah, it's explanation, and letting them have time to soak it in. Some people, when they first find out they've got Hep C, are pretty shattered. And I think that again is with the stigma and the discrimination. So we walk the journey with them. Sometimes the news is not all bad, sometimes they're negative. Even if they are positive that it's not just an immune reaction, they're actually positive, then there are options. And those options are now made much easier by the new treatment.
It's really important that people actually get to know their status, so know it and then treat it and then beat it.
It's really important that we all get tested and get treated if we need to, because we can be cured. And then also that we continue to practice safe injecting and safer drug use, because that way we can help eliminate hepatitis C in our community.
It is 3 pills once a day. It has very little side effects. There's a few things that you have to be careful around, but it's just going to be so much easier. It's not onerous treatment, and we're really excited about it. Now it's a lot easier than 8 years ago, when the chances of clearing were very difficult and the treatment was pretty brutal.
You don't have to stop using to get tested or treated. And if anybody tells you you do, get in touch with us at the Needle Exchange and we'll be able to help and assist you. There's absolutely no evidence that if you're still using, the treatment won't work and that you won't be able to adhere to the treatment.